Hello, good evening, everyone. My name is Dr. Shilpa Agrawal. I am a senior IVF consultant at Medicover Fertility, Chandigarh branch. So today here I am here to discuss about egg freezing, how to preserve your fertility, how to secure your future. So egg freezing synonymous with also known as oocyte cryopreservation, also known as fertility preservation, also known as the social egg freezing or oocyte freezing. So now, what is oocyte freezing? First, we'll know what is oocyte freezing. The oocyte freezing is the extraction of egg from a female. It is frozen and then stored to preserve the reproductive potential of any female. So now egg freezing is a boon for the females of reproductive age. Next come is what are the indications of oocyte freezing. Not all females go for oocyte freezing, and who are the patients whom we advise for egg freezing. So the egg freezing can be advised for a number of medical indications, social indications, legal indications. So the first and foremost is the medical indication for the oocyte freezing. The oocyte freezing, it started with the preservation of fertility in the patients with cancer. So the post-pubertal patients or post-menarchal patients, the reproductive age females, the cancer incidence is almost 10%. In those girls, to preserve the fertility, the concept of oocyte freezing came into place. So in those patients who are undergoing a gonadotoxic chemotherapy or planned for a radiation therapy or planned for a surgery which includes an oophorectomy, that is removal of the ovaries, so for those patients, the concept of oocyte cryopreservation came into place. And till 2013, the oocyte freezing was done for the patient whom it was done for the cancer patients. But after 2013, the guidelines have come for planned oocyte cryopreservation, that is social oocyte freezing has been made to can be done over the time. Now, other causes of the other malignant indications in which the oocyte freezing is done is the breast cancer patients. So, in the breast cancer patients with BRCA positive genes who are planned for a bilateral oophorectomy to prevent the risk of ovarian cancer, in such patients also, if the family is not completed, they can go for a oocyte preservation. Next medical indication comes in the patients who with the autoimmune disorders who are planned for gonadotoxic therapy. So those patients can go for a oocyte cryopreservation. Another set of patients are those with genetic disorders such as X chromosome deletion, Turner syndrome, or those patients who are at risk of premature ovarian failure or premature ovarian insufficiency detected with fragile X premutation. Such patients can be advised for oocyte cryopreservation. Now, a new set of patients are those with patients with endometriosis, severe endometriosis, who are undergoing the surgery for endometriosis, and the chances of reducing the ovarian function and ovarian follicles is much. Those patients also can go for oocyte cryopreservation. Now, the non-medical indications include the social egg freezing, which is also known as elective fertility preservation or a planned oocyte cryopreservation. What is this? This is what is known as social egg freezing. This social egg freezing, it gives the liberty to the patient, liberty to a female for its reproductive freedom. Now the females, they don't need to compromise the career, they don't need to plan the pregnancy early so that they will lose the reproductive potential at later age. They choose to preserve the eggs and can plan the pregnancy at later age as per their convenience. So this gives the option and liberty to the females. So this is a planned oocyte cryopreservation. Next, non-medical indication is in those patients who are going gender transition surgeries like females to males. So such females can go for a oocyte cryopreservation and then can go for gender transition surgery. Another patients who may require the oocyte cryopreservation is those who are already planned for IVF, but while going IVF, while doing the oocyte retrieval, the husband is unable to provide us the semen sample due to ejaculatory dysfunction, or there is inability to retrieve the sperm in case of obstructive azoospermia in a surgical sperm retrieval procedure. Such patient, and especially in those couples who are not willing to go for a donor semen in such emergency, they can be given option of oocyte cryopreservation for a temporary time, for a short time till we can arrange for the sperm. So these are, and the ethical and the legal indications come, like if a female is divorced and is planning for a remarriage, she can also plan for a oocyte cryopreservation. Or if the child, if a already married and a female with children, but children suffering from a terminal illness, or husband suffering from a terminal illness, can also plan for oocyte cryopreservation. So these are few indications and few set of patients who are advised and who can go for oocyte cryopreservation. Now, the most common question asked is what is the ideal age for oocyte cryopreservation? So, as per the evidence, there is an insufficient evidence to guide any patient, any particular age for oocyte cryopreservation. But it is seen that the results are most satisfactory when the oocyte cryopreservation is done in early to mid 30s. So the age being like 32 to 37 years, the quality and the number of oocytes is obviously optimum. So the reproductive potential of those oocytes has been seen to give a live birth. So it is advised, if you want to go for a oocyte preservation, it should be done at a younger age to get a good quality oocytes. Now, next most common question what is asked and what is to be known is how many eggs should be preserved whenever a patient is going for oocyte cryopreservation. So again, there is an insufficient evidence to guide for this matter ki, how many eggs to be preserved and how much is the maximum and what is the minimum. So there is no criteria, but it has been seen like if a patient less than 35 years is going for oocyte cryopreservation, at least 15x is capable of giving the live birth rate of around 70 to 80%. However, if the patient above 38 years of age, the live birth rate of 70 to 80% is reached when around 20 to 25 oocytes are preserved. So on an average, it is around 15 to 20 oocytes when preserved gives you an adequate reproductive potential to preserve your fertility. Now, what are the methods to collect the oocyte? So the oocyte collection is done by method of oocyte pickup. So in such patients, in the patients with malignancy, we can do a conventional ovarian stimulation protocol in which the gonadotropins are given from day 2 of cycle to 8 to 10 days of cycle. And then the eggs and the follicles are ready. We aspirate the follicles under anesthesia, and the oocyte freezing is done by vitrification method. But in malignancy patient, the lag of 2 to 3 weeks is usually with the conventional ovarian stimulation protocol. So random start protocol also can be done with in the malignancy patient. And suppose if the number of oocytes obtained in one cycle is less, we can go for a duo-stim protocol also with such patients to shorten the time and increase the number of the oocytes. So this is with the malignancy patient. In the planned oocyte cryopreservation, we can go for a conventional ovarian stimulation protocol, which can be antagonist protocol, started from day 2 of cycle, and on the day of pickup, the oocytes retrieved are frozen by vitrification method. Now, how long such oocytes can be frozen? So the guidelines say that we can freeze the oocytes up to 10 years, And there is no difference if the frozen oocyte is being used within a year or 2 years later or 3 years later. So there is no such difference seen uh, in the quality of oocytes and the number of years passed with the freezing. And now, another thing which is a query which comes with the patient is ki, what will be the outcome of this oocyte freezing? Is there any difficulty with my pregnancy, or there will be any difficulty with the baby? So, however, there is very little data on this, and the evidence what we have is insufficient, and still studies are going on. But whatever results we are having shows ki there is no difference between the obstetrical outcome and the neonatal outcome in those patients who go with a frozen oocyte or with a fresh oocyte and IVF. Now, after when these oocytes are used for fertilization with the partner's sperm, so it is wise to split the eggs with IVF and ICSI to decrease the risk of fertilization failure. So there is a question, how long will it take to complete the process? So as I told you, if you are planning for a planned oocyte cryopreservation, so planned oocyte cryopreservation, it starts from day 2 of cycle, and the stimulation, the ovarian stimulation, it starts on day 2 of cycle, and it takes around 8 to 10 days of injections to make prepare the follicles, and after that the trigger is given and the oocyte recovery is done. So it takes around 10 to 12 days to retrieve the egg from the female starting from the day 1 of period. Before that, the patient is advised to take all the blood tests and a scan. And if any medical illness diagnosed, like thyroid, sugar, blood pressure, and all, that is being treated before the oocyte stimulation or ovarian stimulation is started. So it is just the process of 10 to 12 days starting from day 1 of periods. So next question what we have is, uh, do I need to undergo any test before this procedure to understand the number and quality of eggs I can get? So the number and quality of eggs cannot be predicted accurately with any test. However, we do test with the ovarian reserve testing, like we do a scan, a baseline scan to see the antral follicle count. We can do an additional ovarian reserve test, that is anti-Mullerian hormone. The combination of antral follicle count and anti-Mullerian hormone, it gives an idea of the availability of the antral follicles in that particular cycles in which we are doing the oocyte retrieval. Suppose one ovary is showing antral follicle count of around 8 and another ovary is showing antral follicle count of 8. So before starting the stimulation, we predict that we are targeting around 15 to 16 antral follicles, and if the response to the drugs is good, we will be able to retrieve 14 to 15 good quality eggs with you. However, the quality of eggs, it again depends on the age of the patient. If the patient is doing this procedure at 34 or 33 years of age, the quality of egg is expected to be better. Contrast to that, if the patient is getting the procedure done at age of 38, 39 years, so if I am predicting the antral follicle count of around 14, 15, then also there is no surety that I would be able to recover good quality 14, 15 eggs or not. Also, a factor which determines the quality of egg is the patient's lifestyle and the BMI. So, if you are planning for an oocyte cryopreservation and your BMI is on higher side, so it is better to reduce the weight by 5 to 10% and then go for a oocyte cryopreservation, unless until you are very short of time and your age is advancing. So next question is, what is the cost of total ICSI process? So talking about the oocyte cryopreservation, if only oocyte cryopreservation is done, The costing includes like the injection costing, which goes around 60 to 70,000 on actuals, whatever injections the patient is taking. Now, the injection costing depends on the patient's age, patient BMI, and the response of the patient to the gonadotropins. Then the ICSI procedure or the lab charges is a separate thing, which varies in India from 1 lakh to 1.2 lakhs, or from 75,000 to 1.2 lakh, you may say. But the ICSI is done in oocyte cryopreservation at a later age when you are planning for the pregnancy. If we are saying about the oocyte cryopreservation only, it is just the ovum pickup charges and the freezing charges. Then later on, the ICSI charges can be added. So now we have a question like, how many days rest is required post procedure? So in oocyte cryopreservation, no rest is required. Even in IVF procedure, no rest is required. The 8 to 10 days injection what you are getting from the clinic is daily. You may visit the clinic to take the injections, or the injections may be packed and given to you for a span of some 3 to 4 days, and then called for the scan, then injections given, packed and given to you for 3 to 4 days. So it is hardly 3 visits to the clinic. Fourth visit is for the ovum pickup, and on the day of ovum pickup only I advise my patients to rest for the whole day, because because a short general anesthesia is being given to the patient. Sometimes the patient, after reaching home also, they are drowsy little bit, and half a day fasting is almost there. So I advise the patient to rest for that particular day, so that they can just because of the drowsiness or because of the side effects of the anesthesia. So other than that, very next day of the ovum pickup, you can go back to work or back to your daily routine, whatever you are doing. So no rest is as such. There is no rest required. So Lavanya here is asking, what is the ideal age to freeze the egg? So hi Lavanya, the as I already discussed earlier, that most commonly with the paid question asked is the what is the ideal age to preserve the freeze the eggs or the oocyte cryopreservation. So there is an insufficient evidence to guide you about a particular age for egg freezing, but still we say, if the freezing of the egg is done in between early 30s to mid 30s, you will get the best reproductive result with those eggs, best reproductive potential eggs. So if the uh, as the age advances, the quality and the quantity of eggs, it decreases. So it is better to preserve your eggs before 35 years of age, preferably 32 to 36 years of age is the ideal age, as per the studies and as per the literature, to preserve the eggs. But less than 30 years also, a patient go for freezing of the eggs, but it has been seen that at very early age, even if you are freezing the eggs, they are less likely to utilize those eggs, when because later some 32 33 they are getting married, and they can have a spontaneous conception also. So next question is there any risk or side effect associated with this process? So there is no risk or side effect associated with this process. The side effects, what you feel is the pain with the injection, and that pain is also minimal at the injection site, which is usually managed with cold fomentation. There may be some redness at the injection site, but nowadays the injections, they are made with such fine needles. They are similar to the injections which like we give the vaccination to the kids or vaccination to the adults. So those injections are also not painful, and most of the injections are subcutaneous injection, so you can administer on your own. With injections, some patients may feel nausea, vomiting, or bloating. That is because of the hormonal side effect, because we are giving you the hormonal injections. So after that, some discomfort may be there, And this is also reported by some patients, not every patient, and can be easily managed. If you have some gastritis, can be easily managed with antacids. And if you have some pain, some local cold fermentation, hot fermentation can be done with at the injection site. Otherwise, there is no long-term side effect with this process. So next we have, what are the chances of forming an embryo with a frozen egg? So nowadays, what is there? We use vitrification for freezing. Previously, we were using slow freezing, like some decades back, we were using slow freezing as a method of freezing eggs. So in those cases, the recovery of the frozen eggs after thawing, फ्रीज करने के बाद, थॉ करने में, पिघलाने के बाद हमारे पास जो एग्स की रिकवरी होती थी वो कम होती थी। कि अगर हमने 10 एग फ्रीज किए हैं तो हो सकता है हमें 6 या 7 एग्स हमें अच्छे मिले। बट नाउअडेज विट्रिफिकेशन यूज करने के बाद द oocyte रिकवरी आफ्टर थॉइंग, पिघलाने के बाद हमें अच्छी oocyte रिकवरी मिल जाती। स्टिल द चांसेस ऑफ फॉर्मिंग एन एम्ब्रियो, इट डिपेंड्स ऑन हमारे पास कितने मेच्योर oocytes है, how many metaphase to oocytes we are having. So the chances of forming an embryo depends on the metaphase to oocyte, which again depend on the age at which the freezing has been done, age of the mother which at which freezing has been done. But as such, there is no difference has been seen till date that the chances of forming an embryo with a frozen egg or the chances of forming an embryo with a fresh egg is different. So there are almost equal chances of forming an embryo with a frozen egg and with a fresh oocyte. Fresh, if you're doing oocyte, fresh pickup, and that very same day you're fertilizing with the sperm. So the chances are almost similar till date. So next is how much time is recommended to take this procedure. So I told you, okay, we start the procedure on day 2 of cycle. It takes 8 to 10 days for of gonadotropins injection to prepare your eggs, and then we retrieve your eggs under anesthesia procedure. So hardly 10 to 12 days time is required to complete a oocyte recovery procedure. However, in patients who are doing a oocyte freezing at a later age, or with patients with borderline ovarian reserve whose AMH has been fallen, or the antral follicle count is very low, and the recovery of oocyte after one attempt of oocyte freezing is less. Such patients can go for a duo stim, that stimulation, after stimulation, 2 stimulations in the same cycle to increase the number of oocytes. One stimulation and 1 oocyte pickup is done. Suppose 6-7 oocytes are recovered and frozen. Then again a stimulation is done, 6-7 oocytes are taken and frozen, so that we can pool the number of oocytes. We can increase the number of oocytes to increase the probability of formation of embryos. So in such cases, if we are planning for a pooling of oocytes, the time required may be 1 or 2 months. If 1 month, if we are planning for a double stimulation or a dual stimulation in the same month, or if we are planning 2 different stimulations in 2 consecutive months, so 10 days in 1 month or 10 days in next month. So such cases can be planned in those patients, and in those with a poor ovarian reserve or a diminished ovarian reserve, in which we are planning a oocyte pooling. Next question is multiple time egg retrieval reduces ovarian reserve? So this is not true. The multiple time egg retrieval does not reduce ovarian reserve. The egg retrieval is done of those follicles. Suppose you have a bucket full of eggs. In each cycle, one layer of egg वो उभर करके उसके ऊपर आता है. That particular layer of egg is available in the cycle. So the antral follicles, what we are seeing at baseline scan, are those follicles who has the potential to get recruited in that cycle, and which are sensitive to the hormones. So even if we are not recruiting this, they are finally गोइंग एट्रेसिया, वो अपने आप ही डिजेनरेट होकर के खराब हो जाते हैं। कि अगर आपके नॉर्मल मेंस्ट्रुअल साइकिल में भी 10-12 अंडे उभर करके बाहर आए हैं, जिसको रिस्पॉन्स करके आपका एक ही एग मेच्योर हो रहा है, तो बाकी एग्स का क्या होता है? बाकी एग्स डिजेनरेट हो जाते हैं, बाकी एग एट्रेटिक हो जाते हैं। तो in IVF process, what we are doing is we are utilizing all those 10-12 eggs which are available in that particular cycles to increase the reproductive potential, to increase the fertility. So next question what I am having is, are the injection painful? जैसे कि मैंने अभी बताया कि injections painful नहीं होते हैं, they are very fine needle injections, most of the injections जो होते हैं subcutaneous होते हैं, similar to those जैसे कि डायबिटीज के पेशेंट डेली इंसुलिन लगाते हैं, उनको भी पेन नहीं होता, उसी तरीके के इंजेक्शन सबक्यूटेनियस इंजेक्शन होते हैं। या फिर इंट्रामस्कुलर इंजेक्शंस आर दोज लाइक कि बच्चों को वैक्सीनेशन देते हैं, दे आर आल्सो नॉट पेनफुल। Some pain at the injection site, some redness at injection site can be there in some patient, which can be managed with local hot fermentation or cold fermentation. Otherwise, the injections are not painful. So next question is egg freezing better than embryo freezing? I would suggest embryo freezing is better than egg freezing because gametes are more sensitive than the embryo. Embryo is stronger and a tougher structure. So embryo survival after freezing and thawing, फ्रीज करने के बाद और उसको पिघलाने के बाद जो एम्ब्रियो सर्वाइवल होता है वो ज्यादा होता है एज कंपेयर टू egg freezing. But in some conditions, some countries like Italy, they don't allow for embryo freezing. So the only option remains with the couple is egg freezing or sperm freezing. But and also egg freezing is it is a single gamete freezing. So the female always has that liberty and freedom of using her gamete. If a female is preserving embryo, so it is the gamete of both couple, the female and her partner. So the liability to use that embryo lies on both. The consent of both the partner is always required to use an embryo. But if we are freezing an egg, it is whole and sole responsibility of the female for what purpose she wants to use the egg. She wants to discard the egg. She wants to use the egg with her husband. If she is divorced, she wants to use the egg with her second husband. So the freedom lies with the patient, with the female to use the egg. So each comes with the pros and cons. Obviously, if you ask clinically, embryo is a tougher structure and the survival of embryo is more than the egg, but still we are advancing and the freezing method is nowadays becoming more secure, more refined and all. So egg freezing is also successful. So next question what I am having is, do I need to get admitted for this procedure? The 8 to 10 days of ovarian stimulation does not need a hospital visit or admission. You need to get, it is a daycare, you need to get admitted for a ovum pickup procedure. It is a daycare procedure. Usually we admit the patient at morning like 9 o'clock or 10 o'clock. We do the procedure. It is an 15 to 20 minutes procedure with a short general anesthesia, and the patient is discharged after 3 to 4 hours. And so that's all admission is required. Next question what we are having is, what is the minimal age where we can do freezing? So minimal age, again I'm telling you, it is advised that the egg freezing can be started post-pubertal, post-menarchal. That is indicated post-pubertal and post-menarchal when the patient is suffering from a cancer in reproductive age, when she has landed in reproductive age. So as early as like 14 years or 15 years when she has attained menarche. So that can be the minimum age we can do the egg freezing. However, apart from those patients who are suffering from cancer, if we are going for an elective oocyte cryopreservation, The patient can do egg freezing at any age, the younger the better. But as I already told, that doing egg freezing at very early age is also sometimes patient do not need to use those or eggs also. And so an ideal age is like 30s to early 30s to mid 30s. Now, another question is there any way to increase the egg quality? The egg quality decreases with the age, and the quality of egg is always assessed when we retrieve the egg and we see the egg under the microscope. So the quality of egg cannot be assessed beforehand, and we can only assess the quality of eggs when we are seeing the egg under the microscope. But to increase the egg quality, you have to de-stress yourself. The stress, it increases the oxidative stress, and it damages the eggs. It increases the mitochondrial stress. So you have to meditate, do yoga, can do exercises, maintain optimum weight, take optimum green leafy vegetables and colored fruits. So all these are rich in antioxidants and may increase the egg quality. And when you are advancing age and your reserve is getting poor, some form of androgens like dihydroepiandrosterone or testosterone gel may be used to increase egg quality when you are undergoing IVF process. So a lifestyle modification is must to increase the egg quality. Whatever form of stress you are having, you have to de-stress yourself. So next question, what we have, I can work and go to my office during this entire process. Exactly, you may go, Pinder, you can go to work, you can go to office during this entire process. I never advise my patient to take leave during IVF process. You can always take out time during your lunch break or before going to office, or leaving from office, working 10 to 6, and uh, you only have to visit hospital for 8 to 10 days, initial 8 to 10 days for the scan, which includes only 3 visits. Like if I do a baseline scan at day 2 of your cycle, and then I advise the injection, you can fix a time and you can go to the center, take the injections, take the shots, then come back to office, do your office job. Then again, when I call you for scan, some day 6, day 7 of cycle, that again may need your 5-10 minutes of during the scan, then you can take the shot and go. So like 3 visits during your ovarian stimulation, one fourth visit will be the ovum pickup procedure. And that very day you may require a leave from office because we usually call in morning, and it requires fasting. It's done under anesthesia. It's a daycare procedure. So that very day, I tell my patient to take a leave from office. So only 1 day leave is required. Later on, when you use your eggs to fertilize with your partner's sperm, then during the day of embryo transfer, you may require another leave from office. Apart from that, there is no bed rest, no leaves from office. You can work, you can go to office, you can do your regular activities during this entire process. So next is what is the exact age for egg freezing? We are still, there is insufficient evidence to tell the exact age for egg freezing. However, it is preferred to do the egg freezing in early to mid 30s. 32 to 37 years of age is preferred for egg freezing. So next question is, I have heard bed rest is recommended throughout the process. Let me know if this is true. So this is not true. Bed rest is not recommended throughout the process. As I answered already earlier, you may go to work, you may continue your office, you may continue household activities, and bed rest is not recommended nowadays. We tell patients whatever you were doing before the IVF process, you can continue everything whatever you were doing before. You should not start anything new after you get your embryo transfer or IVF process done. Like you suddenly started running or suddenly started athletics. So this is all not advice. every household activity, even climbing the stairs, going to office, driving the cars, everything is allowed after you go in IVF embryo transfer procedure. So bed rest is absolutely not recommended. So next is what is the chances? What is the success chances of egg freezing? So the success chances of egg freezing again depends on the age of the female, at what age she has frozen her eggs, and the quality of embryos, what is formed. So if a patient preserves her egg around 32 to 35 years of age, usually the chances of pregnancy with such eggs is 70 to 80%. So next question is, what are the chances of multiple pregnancies in IVF procedure? So usually the clinician is cautious to use the number of embryos transferred during the IVF procedure. As per law, we are advised to transfer only 2 embryos in IVF procedure. However, a good blastocyst is sufficient enough to give the pregnancy rate, and a single blastocyst transfer can also be done. If we are transferring two good quality embryos, the chances of twin pregnancy is there, but higher order IVF pregnancies like triplet, quadruplet is avoided, and we don't transfer more than 2 embryos. So next is how long does it take to complete the procedure? So it takes around 10 to 12 days. Like we start from day 2 of cycle, we give injections for 8 to 10 days, and then your ovum pickup is done and oocyte recovery is done, and the oocytes are frozen the very same day. So it's hardly a 10 to 12 days procedure. So next question is, for how long eggs can be kept frozen? So the eggs can be kept frozen for about 10 years of age. It can be frozen, and there is no difference in the quality of eggs if used at after 1 year of freezing or 5 years of freezing. So the time duration for which the eggs are frozen does not affect the quality of eggs. So they can be frozen up to 10 years of age. So, to summarize, I would like to say about oocyte preservation is oocyte preservation. It has given the freedom to the females to choose when to plan for the pregnancy. They are not forced to leave their job, the career. They can balance the work. There can be a work life balance with a professional life being not suffered because of the personal life. And usually, if you are going for an egg freezing procedure, you plan little early, like mid 30s, and try to preserve around 10, 15 eggs. Try to preserve around 15 oocytes, and obviously, this oocyte preservation is helpful in those patients of reproductive age suffering from malignancy, and it helps them to choose an option of pregnancy later on, by using their own uterus or by an option of taking a surrogacy. So it's a boon for those patients who are suffering from cancer and also who want to delay their fertility. So we have few more questions. Hmm. So, how is semen freezing different from egg freezing? Semen freezing process is not a difficult procedure. This semen, what is being taken, like if you're going for a semen analysis and the collection of the semen by masturbation process is done, and that very semen, the analysis is done. So, same semen can be frozen on that very day. So it does not require any particular type of injections or a particular anesthesia for a semen freezing. The male has to come to center, give the semen sample, and that semen can be frozen after consent. But egg freezing, it requires the ovarian stimulation, the removal of the eggs, the extraction of the eggs under anesthesia. So it is different from the semen freezing. So next is, can I donate my frozen eggs to my relative? No, you cannot donate your frozen eggs to your relative. You can only use your frozen eggs. Next, we have, what is the process of egg freezing? Shall I have to come to hospital on daily basis? So the process I've already explained. It starts from day 2 of cycle. The ovarian stimulation comes, and during the ovarian stimulation, you have to visit 2 or 3 times your IVF specialist for the scans. And if you want to take the daily injections at hospital, you may fix a time, come and take your daily shots, or you may pack the injections from your IVF center, take to your home. Can administer yourself because it is a subcutaneous injection, or you can take it and get administered at nearby dispensary near to your home. And uh, then the ovum pickup is done, which is a daycare procedure done under anesthesia, which requires around 4 to 5 hours of stay in hospital. So that's all. Thank you.